Hi, my name is Simsini and today I'm gonna talk about the research topic and introduction. Mental health is not a crime, but it serves as a warning sign for the growing number of people worldwide who are afflicted with mental illness. Modern science has established that mental health issues were the fundamental cause of many ailments, and these issues have a significant impact on community health. Anxiety and sadness were the two most prevalent mental diseases that contributed significantly to the main causes of impairment. The majority of people see mental illness negatively since it adds to a nation's financial burden, despite the fact that these disorders are curable. Additionally, mental diseases have a significant influence on people of all ages, socioeconomic status, ethnicities, religions, and background. In order to paint a clearer picture of the current condition, the problem and difficulties with mental health in Malaysia are being researched and analysed. Therefore, the issue of how to address mental health issues was brought up in an effort to lower statistics and enhance the quality of life. In this research article, a case study was carried out to gather opinions from the community regarding their perception of the problems and issues with mental health in Malaysia. To alter the world by 2030, the Sustainable Development Goals highlighted mental health disorder as a critical component of their agenda. In most nations, it makes up a sizable amount of health issues, and Malaysia was predicted to have its share of serious issues as well. According to the studies, mental health problems are the primary cause of illness and impairments worldwide. Additionally, given that mental health is an essential element of economic development, mental diseases are one of the causes that lower production levels and employee well-being. In general, mental health is seen as a state that affects how people think about and approach their daily tasks and activities. Additionally, it is crucial for understanding the many ways that individuals deal with stress, how they relate to one another, and the options that are open to them in the given circumstances. The World Health Organization defines mental health as a condition of well-being in which people are aware of their capacity and skills for managing the degree of stress in their lives. Additionally, it alludes to how productively people can give back to their communities. According to the Ministry of Health, mental health is described as the interaction of the person, the group, and the environment of improving personal well-being and the best course of action when using cognitive and affective skills to achieve both individual and group goals. According to the Ministry of Health survey, 4.2 million persons, or 29.2% of those aged 16 years old and older, experience mental health issues. Because of their propensity to damage oneself and exhibit suicidal behavior, these people need the right kind of counseling and support to help them overcome their issues. According to studies, those aged 16 to 19 had the highest rate of mental health issues, as high as 34.7%, followed by adults aged 20 to 24, which stands for 32.1%, and people aged from 25 to 29 is 30.5%. Thank you.
Good evening, my name is Pritika Ilangovan. Today I am going to present about the problem statement of our topic, that is mental health issues. 4.0 Problem statement. Mental health issues are common that you may think. The emotions may be mistaken for being moody or emotional, making it difficult to recognize the indicators. In many ways, mental health is just like physical health. Everybody has it and we need to take care of it. Being typically capable of thinking, feeling and acting in the ways that you need and desire to live your life is a sign of a good mental health. Here are 4 potential causes of mental health issues, which are physical, environmental, social, economic, and genetic as well as trauma. The next one is 4.1 physical environmental factor. One of the many pervasive health issues is mental illness, which has complicated and multiple underlying causes. Many people believe that mental illness just naturally occurs in families. This may be the case, yet genetics only make up with a portion of it. The environment and the way of life of an individual as well as other variables can all contribute to these diseases. 4.2 Social environmental factors. A person's capacity to manage stress may be impacted by socio-economic, racial, and ethnic and relational issues collectively referred to as a social environmental factors. Not having a robust social support system is a prime example. Let's imagine that someone has a divorce or a jobless. Experts with qualification from graduate programs in marriage and family counseling suggest that having encouraging friends and family during this time is essential to their capacity to handle stress. 4.3 Social and economic factor. Most social factors including gender, socio-economic, class, race and ethnicity, and household partners and social institutions have an impact on physiological wellness and mental disease such as disability and social security systems, labor markets and healthcare organizations. The social structures impacting family, jobs, financial assistance and medical treatment have a significant impact on our ability to properly manage the expanding number of people with mental illness and or dementia.
Hello there, I'm Junjian. Today I'm going to present about the results and discussion of the topic called mental health issue. So the person who have mental health issues will feel a variety of emotions like sadness, anger, and guilt. And this issue will also seriously alter the family dynamic. In order to solve this problem, the family can seek professional assistance such as therapy or counseling. Family therapy can be a helpful tool for families to process their feelings and create coping and healing methods together. So for the individual, a person's behaviors and thoughts patterns cannot alter as a result of mental health disorders. So the issues can be upsetting, hinder daily activities, and have a detrimental effect on the quality of life. In order to handle this problem is by engaging in self-care practices like exercises, mindfulness, or enjoyable hobbies. The dynamics of the family as a whole, as well as individual family members, can be impacted by mental health issues in home. For example, the relationship stress and strain brought on by mental health issues can result in arguments, social isolation, and communication breakdowns. Open communication, empathy, and getting professional assistance, such as therapy or counseling, can all be effective management techniques. The consumer who have experienced the mental health issues may also have major effects on their everyday life. For example, like distress, poor performance at work or school, and strained personal ties can all be results of mental health issues. In order to solve this issue is to get an expert assistance such as counseling or medication, or can also do self-care practice like exercise or hobbies can also assist them in managing their symptoms. So for the private agency, the employees with mental health issues could have an effect on the agency's overall effectiveness. In order to solve this issue is that can receive assistance from private organizations by taking advantage of tools, for example, EAP or mental health benefit. That's all from me. Thank you.
Hi, my name is Yap Lai Zi, and I'm going to do a conclusion about this topic, which is mental health. Okay, first, seek professional help is very important for us. Think about contacting a mental health specialist, like a therapist or physiotherapist. who can offer assistance, direction, and therapy. An essential first step in managing mental health difficulties is to seek expert assistance. The following points should be remembered. Locate a mental health specialist. The type of mental health condition you are having should be treated by a licensed therapist. You can use your health insurance company or web directories to look for providers. Second, set up a meeting. Make an appointment by contacting the mental health professional office. Be prepared to share details about your insurance, medical history, and treatment goals. Show up for your appointment. Arrive at your appointment on time and discuss your symptoms and concern openly with your provider. They might inquire about your past, present circumstances, and therapy objective. Third, continue with the treatment. Therapy, medicine, or combination of the two may be used in the treatment of mental illness. It's crucial to adhere to your doctor advice and show up for all appointments. In addition, you could be requested to engage in self-care practice outside of scheduled appointment. Fourth, speak up and represent yourself if you feel that the care you are receiving is inadequate or if you have questions about your course of treatments. You can ask a different mental health specialist for a special opinions. Keep in mind that you are entitled to high quality mental health care. 6.2. Set achievable goals. An essential component of managing mental health concern is setting realistic goals. To help you develop goals, consider this advice. Firstly, begin modestly. Start by making short-term, manageable goals that are simple and easy to achieve. This may foster confidence and forward motion. Second, make it clear. Be clear about your goals you have in mind. Say, I want to go for a 30 minutes walk 3 times a week. For instance, rather than I want to exercise more. Third, make it quantifiable. Ensure that your objective can be quantified. You may monitor your development and maintain motivation by doing this. You may, for instance, keep note of how frequently you reach your weekly activity goals. 6.3. Challenge negative thoughts. Dealing with mental health difficulty requires challenging negative thoughts. Here are some points for combating unfavorable thoughts. Firstly, recognize negative ideas. Be aware of your thoughts and pay attention to when they turn negative. Journal your unfavorable. Second, create unfavorable feelings. Consider whether the negative thought is accurate. Does it have supporting data? Is it a reasonable or imperative thought? Third, negative thoughts should be transformed into natural or positive one. Reframe negative thought like I'm failure into positive one. I make a mistake, but I can learn from it. 6.4. Practice self-care. Self-care is a crucial component in managing mental health difficulties. Here are some points for self-care. Firstly, make time for yourself. Allocate time each day to engage in a relaxing activity. Second, practice mindfulness by engaging in exercise like yoga, deep breathing, or meditation to become more attuned to the present moment without passing judgment. Third, regular exercise can help with mood and stress irritation. Must make a habit of doing an exercise you enjoy, like swimming, dancing, or walking, and include it into your daily schedule. Fourth, eat sensibly. Eat a balanced, healthy diet can help you alleviate mood and lessen stress. 6.5. Manage stress. An essential component of dealing with mental health disorder is managing stress. To reduce stress, consider the following advice. Firstly, make a list of things that stress you out to help you identify your stresses. This can aid in pattern recognition and the discovery of coping mechanisms for stressful situations. Second, exercise that induce relaxation such as yoga, meditation, or deep breathing should be practiced. Third, regular exercise can help lower stress and enhance both physical and mental health being. Okay, that's all for my point. Thank you so much.